A very warm good morning to one and all present in this lecture session. I am Dr. R. M. Poddar, Associate Professor from the Department of Electronics and Telecommunication Engineering of Bhilai Institute of Technology, Durg. In this lecture session, I am going to cover the topic privacy and security concern in medical data. The flow of my lecture session will be like this. So, now let us begin with the introduction and importance of privacy and security concerns in medical data. In introduction, digitization impact. With the rise of electronic health record, that is EHR, and telemedicine, the addressing of privacy and security concern in medical data has gained paramount significance. Next point, evolving challenges. In this presentation navigates through the complexities of data breaches, regulatory compliance, technological advancement and ethical dilemmas in safeguarding sensitive patient information. Next point, interconnected healthcare. In this, medical data becomes more interconnected and accessible, grasping the refinement of these concerns because crucial for upholding patient trust, compliance standards and the resilience of the healthcare ecosystem. Essential exploration. Investigating into these multifaceted dimension trains stakeholders with the knowledge needed to proactively track privacy and security challenges in the digital era of healthcare. In importance, patient trust and confidentiality. Maintaining the privacy and security of the medical data is fundamental to upholding patient trust. Individuals are more likely to share sensitive health information when they believe it will be kept confidential. Legal and regulatory compliance. Healthcare organizations are subject to stringent data protection regulation such as HIPAA, GDPR and IT Act 2000. Failure to comply with these regulations can result in severe legal and financial consequences. Preventing data breaches. Medical data breaches can have terrible consequences including identity theft, financial fraud and medical fraud. Healthcare decision making. Accurate and reliable medical data is essential for healthcare professionals to make informed decisions about patient care. Research and public health. Anonymized medical data, which means to remove identifying information so that the original source cannot be known, is often used in research purpose to advance medical knowledge, improve treatment and contribute to public health efforts. Ensuring data privacy is crucial to both integrity of research and protecting individuals' right. Identity theft and fraud prevention. Medical data contains sensitive personal information that can be used for identity theft and insurance fraud. Protecting this data is vital to preventing financial and personal harm to patients. Telemedicine and remote healthcare. The rise of telemedicine and remote healthcare has increased the transmission of medical data over digital networks. Securing this data is crucial to maintaining patients' privacy and preventing unauthorized access. Healthcare reputation. A data breach can tarnish the reputation of a healthcare organization, leading to loss of patients, partners and stakeholders' trust. Ethical consideration. Respecting patient autonomy and right is an ethical obligation. Data sharing and interoperability. Secure data exchange between healthcare provider, institution and system is essential for providing comprehensive and coordinated patient care. In summary, medical data privacy and security are essential to protect patient right, uphold trust, adhere to legal regulation, ensure accurate medical decision making and contribute to advancement in healthcare and medical research. Now, coming to the topic medical data, which will covered by definition and types. So, first definition: medical or that is clinical data refer to health related information that is associated with regular patient care or as part of clinical trial program. Medical or clinical data falls into 6 major category, that are electronic health record, that is EHR, administrative data, claims data, patient registry, disease registry, health survey, clinical trials data. Medical data privacy and security are paramount importance due to several compelling reasons. Firstly, they safeguard the confidentiality and integrity of sensitive patient information, fostering trust between patients and healthcare provider. Secondly, compliance with stringent regulation like HIPAA and GDPR in US and in European Union and counterpart IT Act 2000 and DPDP bill in India are essential to avoid legal consequences and financial penalties. Thirdly, breaches of medical data can lead to identity theft, financial fraud and compromised patient safety, emphasizing this need for robust protection measures. Furthermore, accurate and secure medical data is crucial for informed healthcare decision making and ensuring optimal patient care. Optimal means best treatment at cheapest price. In an interconnected healthcare landscape, maintaining privacy and security is vital to prevent unauthorized access, maintain reputation and uphold ethical standards. Now, coming to point legal framework, in which I will be covering HIPAA and GDPR and Indian laws and regulation. HIPAA, that stands for Health Insurance Portability and Accountability Act, is an essential US legislation that assures the privacy, security and standardized transmission of medical data. It establishes stringent guidelines for healthcare entities including providers, insurers and business associates to safeguard patient confidentiality. In European Union, GDPR, that stands for General Data Protection Regulation, serves as a comprehensive framework that shields individuals' personal data including healthcare information by regulating its collection, processing and storage. In India, the IT Act 2000 governs electronic transaction of data protection including healthcare information security. The upcoming DPDP bill, that stands for Digital Personal Data Protection Bill, seeks to further strengthen privacy rights and data protection, particularly in healthcare sector domain in India. For better understanding the concept, please do complete the simple exercise given in the slide with the heading exercise. Next point, data breaches in healthcare. Impact on patients and impact on organization, these are the 2 points to be covered. Impact on patients. First, privacy violation. Medical data breaches expose patients' sensitive personal and health information, violating personal patient privacy. Financial consequences. Stolen medical information can be used for fraudulent insurance claim. Medical identity theft. Breached medical data can be used to obtain false medical services. Stigma and discrimination. Sensitive medical information revealed in a breach can lead to stigmatization and discrimination, especially for patients with sensitive condition like mental health issues and infectious disease. Emotional distress. Patients may experience anxiety, stress and emotional distress due to violation of their privacy. Trust erosion. Patient might lose trust in healthcare provider and the security of data, affecting their willingness to share accurate information and seek medical care. Then coming to impact on healthcare organization. Reputation damage. A data breach can damage the reputation of healthcare organization, leading to loss of patient trust and potential long-term negative effects on their business. Legal and regulatory consequences. Organization can face legal penalties and regulatory fines for failing to protect patient data as required by laws like HIPAA or GDPR. Financial losses. Breaches can result in financial losses due to legal fees, regulatory fines, remediation cost, potential lawsuits from affected patients. Operational disruption. Managing a data breach requires diverting resources to address the breach, potentially disrupting regular operation and affecting patient care. Patient distrust. A breach can lead to patient distrust in organizations' ability to secure their data, affecting patient loyalty and retention. Cyber security investment. Organization may need to invest in enhanced cyber security measures and protocol to prevent future breaches, which can incur additional cost. Notification and recovery. Organizations are often required to notify affected patient, assist in recovery efforts and provide credit monitoring services, further increasing cost and efforts. Next point, threat vectors. We will be covering common ways medical data can be compromised. Here unauthorized access says a hacker gain unauthorized access to a hospital's electronic record, that is EHR system, and steals patient data. In inside threat, it says a employee at healthcare facility intentionally accesses patient record without authorization. Ransomware attack says a malware attack infects a medical facility's computer system, encryption patient data and demanding a ransom for its release. That means demanding money against decryption key. Lost or stolen devices. A doctor's laptop containing patient record is stolen. Phishing attack. It says healthcare staff receiving convincing email phishing messages. Inadequate encryption. Patient data transferred between medical facility is not properly encrypted, leading to data encryption interception by malicious actors. Third party vendor breach says a vendor responsible for managing a hospital's billing system experience a breach. Point, poor data handling practices says improper disposal of a paper based medical records or electronic storage devices. Point, telehealth vulnerability says inadequate security measures in telehealth platforms allow unauthorized access to virtual medical appointments and patients' medical information. Lack of employee training. Employees unintentionally share patient data on public platform due to lack of awareness about data protection protocol. Then coming to the point, challenges in securing medical data. Previously, health data management solutions were involved in purely paper based tracking and then slowly transitioned into the digitized format as seen in the current trend. Here the challenge is staff shortage. Complaints about the difficulty of finding trained, experienced personnel are very old in security. Next challenge says skill shortage, again a problem. Next challenge says knowledge shortage is closely related to skill shortage. Another challenge is fragmented data vulnerability, refers to weaknesses of points of risk in the security of data, which is information stored in various forms. One type of data is called structured data. Structured data in the context of healthcare can take several forms: database management system, or saved as image and video files, stored in specialized format, scanned paper, documents, and many more. Data in healthcare is widely duplicate stored and collected multiple times in various versions, which can introduce vulnerabilities if not properly managed or protected. Next challenge is about data changes. Organizational problem in healthcare is that medical data is constantly changing due to patients constantly undergo numerous tests and treatment over the years. New types of health data management solution include telehealth modules, creating further new data types. Next challenge says about regulatory compliance, which underscore health data are sensitive material and very prone to health data breach. Healthcare organizations are required to adhere to government compliance and regulatory act like GDPR and IT Act 2000. Data management for healthcare like data discovery faces challenges due to poor data quality and making it difficult to perform during audits and regulatory requirements. Next challenge is inadequate data integration. This challenge underscore to continue to be one of the ongoing challenge in the healthcare technology, as various health data management system can talk to one another to receive a comprehensive overview of the patient data. Next challenge, that is overload of data. Healthcare data can be overwhelming on healthcare data management software. Organizations and enterprises are required to invest in healthcare IT security infrastructure more effectively. Then coming to protected health information, abbreviated as PHI. So, first I will be saying about definition of PHI. PHI defines as PHI refers to any individually identifiable health information that is created, received, transmitted or maintained by a covered entity such as healthcare provider, health plans and health clearing houses, and relate to the past, present and future physical or mental health of an individual, the provision of healthcare services to an individual or the payment for healthcare services provided to an individual. PHI include various types of data such as medical records, diagnosis, treatment information and even demographic information like name, addresses and social security number, which when associated with the health information. PHI is subject to strict privacy regulation. Measures to protect PHI. Here we discuss some key measures to protect PHI. First one, access control, which says limit access to PHI based on roles and responsibility. Use strong authentication method like password, biometric and multi-factor authentication. Second point, encryption. Encrypt PHI both in transit while being transmitted and at rest when stored to prevent unauthorized access in case of breaches. Third point, secure infrastructure. Maintain secure network configuration, firewall and intrusion detection system to prevent unauthorized access and cyber attacks. Next point says regular audit and monitoring. Conduct regular security audit, track system activity and monitor for usual behavior to detect and respond to potential breaches. Next point, employee training. Train staff on HIPAA regulation, security protocol and other proper handling of PHI to reduce human error and breaches. Physical security. It says ensure physical security measures like restricted access areas, security cameras and proper disposal of physical documents containing PHI. Business associate agreement describes establish agreement with third party vendor, that is business associate, to ensure they also adhere to PHI protection requirement. Data backup and recovery point describes regularly backup PHI and establish disaster recovery plans to ensure data availability, even in case of system failure or breaches. Point policy and procedures says develop and enforce comprehensive policies and procedure that outline how PHI should be handled, accessed and shared. In point incident response plan, it explains have a plan in place to respond effectively to security incidents including breaches notification to affected individual and regulatory authorities. Then secure communication describes use encrypted communication method, for example secure email, when transmitting PHI to ensure its confidentiality. Secure disposal, properly dispose of physical records and electronic devices containing PHI using method that prevent data recovery. In today's digital landscape where data breaches and cyber attacks are predominant, data encryption is an essential tool for protecting sensitive information, maintaining trust with customer and meeting regulatory obligations. Coming to the point medical data encryption, we will discuss first importance of data encryption. In that first point, confidentiality. Encryption ensures that only authorized parties with the corrected decryption key can access the and understand the data. This particularly important for sensitive information like personal, financial or medical data, as it prevents unauthorized individual or cyber criminals for gaining access. Data breach protection. In the event of a data breach or unauthorized access, encrypted data remains meaningless without a proper decryption key. Even if attackers gain access to encrypted data, they would face significant challenges in deciphering it, reducing the impact of a breach. Regulatory compliance. Many industries such as healthcare HIPAA and finance PCI DSS have strict regulation that mandate the protection of sensitive data through encryption. Implementing encryption helps organization meet this compliance requirement and avoid legal consequences. Data sharing. Encryption enables secure data sharing between parties including business, partners and customer. Encrypted data can be shared over network or stored in the cloud with reduced risk of interception or exposure. Cloud security. When storing data in cloud environment, encryption ensures that even the cloud services provider cannot access the data without encryption key. This adds an extra layer of security to sensitive information. Then mitigate insider threats. Explains encryption minimizes the risk of posed by internal threats such as a employee with malicious intent or those accidentally accessing unauthorized data. Even with an organization, data remains protected without the necessary decryption key. Remote work and mobile security. With the rise of remote work and mobile devices, encrypting data ensures that if a device is lost or stolen, the data on it remains inaccessible to unauthorized user. Data integrity. Some encryption methods also include mechanism to ensure data integrity. This means that the data hasn't been altered or tampered with during transmission or storage. Protection against advanced threats. Encryption can safeguard data from advanced cipher threats like man in the middle attack, where attackers intercept the and manipulate communication between parties. Risk management. Encryption is a key element in an organization overall risk management strategy, reducing the potential financial and reputational damage associated with the data breaches. Encryption method for medical data. The choice of encryption method depends on factors such as the level of security required, the nature of the data, regulatory compliance and usability of encryption process. In the medical field, considering the sensitive nature of health information, it is essential to choose encryption method that provide the necessary protection while also ensuring the smooth flow of patient care and operation. In symmetric encryption, the same key is used for both encryption and decryption. It is efficient for bulk data encryption, but requires securely sharing the encryption key. Asymmetric encryption, also known as public key cryptography. Asymmetric encryption uses a pair of key, a public key for encryption and private key for decryption. This method enhances security, but can be slower for large volume of data. Then next, data at rest encryption. This encrypts the data stored on devices or servers. Full disk encryption and file level encryption are example of data at rest encryption. Data in transit encryption. This secures data as it is transmitted between system or over network. Transport layer security TLS and secure socket layer SSL protocols are commonly used for data in transit encryption. Then end-to-end encryption. This ensures that data is encrypted from the sender to the recipient with intermediary unable to access the unencrypted data. It is commonly used in secure messaging application like WhatsApp is using. Homomorphic encryption. This advanced technique allows computation to be performed on encrypted data without needing to decrypt it first. It is useful for performing analytics on sensitive medical data while maintaining privacy. Tokenization. Tokenization replaces sensitive data with non-sensitive tokens. While the actual data is stored in a secure vault, this method can be used for payment and identification data. Database encryption. Encrypting specific field or entire database adds another layer of security for medical records stored in data. Cloud encryption. When medical data is stored in the cloud, encryption ensures that even the cloud provider cannot access the data without decryption key. Application layer encryption. Encrypting data within application ensures that the data remains secure throughout its processing life cycle. Hardware based encryption. Some storage devices and hardware components offer built-in encryption capability, enhancing security for stored data. Internet of Medical Things, abbreviated as IoMT devices, which incorporate a wide range of interconnected medical devices and sensors, offer great potential for enhancing patient care, remote monitoring and healthcare efficiency. However, they also introduce significant privacy and security concerns due to their connection to network, data exchange capability and sensitive nature of medical data. Here is an explanation of these concerns. Data breaches. Medical IoT devices can be vulnerable to data breaches, such as breaches can be lead to exposure of personal health information, contributing to identity theft, medical fraud and reputational damage to healthcare provider. Unauthorized access. Inadequate security measures may allow unauthorized individual to access, control IoT devices, potentially altering medical settings, interrupting treatment and manipulating health data. Data interception. A medical IoT devices transit data over network. There is a risk of data interception by malicious actor. This intercepted data might include personal health information, leading to privacy violation and compromised patient confidentiality. Device tampering. Hackers could manipulate medical IoT devices, altering their functionality or sending false reading, which could result in incorrect diagnosis, treatment error or inadequate patient monitoring. Lack of encryption. Insufficient use of encryption method during data transmission and storage might expose sensitive health information to eavesdropping or unauthorized access. Inadequate authentication. Weak or absent authentication mechanism can enable unauthorized individual to gain control over IoT devices, potentially affecting patient safety and data integrity. Software vulnerability. IoT devices often rely on software functionality, making them susceptible to software vulnerability that hackers could exploit to gain unauthorized access. Regulatory non-compliance. Many medical IoT devices handle sensitive patient data, making them subject to regulation like HIPAA. Non-compliance with this regulation can lead to legal and financial consequences. Dependency on third parties. Many IoT devices rely on third party services for data storage, processing or communication. This introduces additional security risks, particularly if these third party are not adequately securing patient data. Life cycle management. Ensuring security throughout the entire life cycle for medical IoT devices, from design and manufacturing to update and of life, is challenge that can expose vulnerability if not managed properly. Limited user awareness. Patient and healthcare provider might not fully understand the security risks associated with medical IoT devices, leading to inadvertent action that compromise data privacy. To address these concerns, it is crucial to implement robust security measures such as strong encryption, regular software update, secure authentication and continuous monitoring. Healthcare organization, device manufacturer and regulatory body must collaborate to establish standard and best practices that ensure the privacy and security of medical IoT devices while harnessing their potential benefits. In concluding remarks, I would like to say, in the ever evolving landscape of healthcare technology, the integration of digital advancement presents immense opportunity for improved patient care, diagnosis and treatment. However, as we embrace the benefit of digitization, it becomes imperative to address formidable challenges that accompany it. The paramount of corner of privacy and security in medical data. In conclusion, the pursuit of technological innovation in healthcare must go hand in hand with the commitment to patient privacy and data security. While challenges abound, so too do the solution. Collaboration between healthcare professional, technology expert and policymaker can pave the way for secure digital healthcare landscape that ensures patient trust, enable precise decision making and foster advancement in research and public health. In this era of transformation, safeguarding medical data privacy remains an ethical imperative and a fundamental cornerstone for modern healthcare. Thank you one and all for patience listening.